Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way, it's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast. Hi, my name is Dr. Bruce Baird with the Productive Podcast, and I am here with one of my close friends and fellow dentist, Dr. Nikki Green. Nikki, thank you so much for joining us today.
Thank you, Bruce, for having me. I'm excited to be here.
Well, I tell you, Nikki has a practice in Fort Worth, Texas, a cosmetic. I would call it a cosmetic practice. I think
Primarily.
that's pretty fair. I mean, during one of my meetings, I lost a veneer and had to go to her office and have it re-put on. I remember one night after cocktails. That worked out very well, though, I have to say.
Absolutely. I'll be your emergency dentist any day. Not that I want you popping veneers off. That's not fun, but I'll be your emergency dentist any day.
There you go. Well, we've had a lot of great experiences together in dentistry, and I know that you've actually been to PDA multiple times, and you're married to another friend of mine, Dr. Bob Leedy, from Abilene, Texas, and I've got a chance to go into Bob's practice a few months ago, and just have had a lot of fun. But a few years ago, you sold to a DSO. Like I sold to Heartland years ago, but um, how has that been? I mean, as far as clinical autonomy, you were doing dentistry a certain way. Were there any changes to that, or what have you felt?
Yeah, no, that's a great question. I can report from my situation, clinical autonomy has remained untouched, which is amazing. It's part of even how I chose my buyer. When I even got interested in selling to a DSO, I was very particular about my buyer. And a big part of it was I wanted to maintain autonomy. To be perfectly honest, I really didn't want them to mess with me at all. That was really kind of what I was looking for. I was looking for a buyer that wasn't going to mess with me and let me keep doing things the way I wanted to do 'em. I really just was looking to kind of take some chips off the table, if you really want to know the truth, invest some funds, maybe not carry 100% of the weight myself anymore, but I really wanted to be able to continue doing things the way I'd always done them. And 4 years in, we are now right at 4 years in, because I sold in October of 2021. I can attest that I have that. I have complete autonomy, even to the point where some days I'm going, why am I still running this place? I don't own it. My
Isn't that the truth?
yeah. Um, but and maybe we can talk a little bit about this. What I've also found out is that's a difficult business model for the DSOs. So my DSO, I would even say, has struggled because they contractually gave us full autonomy. Contractually, they can't even come in and change things, systematize things, centralize things. And I have learned, as also an investor in that DSO, that that's not the best business model for a DSO. So it's a double-edged sword. For me, practicing dentistry, I love it. Me as an investor in that DSO, I'm going, ugh, not a great business model.
Yes, yes, been there. Been there. I sold to Heartland. I don't even know how many years ago, but and then of course clinically retired 6 years ago. Hard to believe,
No.
but I wanted clinical autonomy, and I basically told them, you can, I'm interested in selling. This is back during the Obama administration, where I was worried about, oh, I'm going to have to provide all kinds of insurance, all this stuff. And I just got freaked out. Plus, I had some other friends that sold, and I was like, wow, maybe it's time. I was 50, I don't know what I was, 52, 53. And I just decided, all right, it made sense. But I kind of contractually did what you did. But over the last probably 6 years, spending a lot of time studying DSOs and even starting one, I realized the model is very difficult for the investors, because you want to come in and help offices that need help, but you also want to buy practices that don't need help. It's kind of like, where's your growth going to come from? And so that's kind of one of the things that I that I notice more than anything. How about, did you notice a little change in supplies or anything else? Were you able to continue to do the same things or get better deals?
Yeah, so, I mean, honestly, that's one of the benefits. We've definitely gotten better deals, and, when they came in and, my team didn't love it at first when we had to change ordering platforms and, yes, there were some relationships that we had long time had with Patterson and some different things that maybe some of those relationships didn't get severed. We still have those relationships, but they just weren't supported so unilaterally like they had been for a lot of years, but at the end of the day, that saved me money, and that was not a bad thing, and that's kind of where business of dentistry is going. So yeah, so they got us onto an ordering platform. That was one of the things that they did kind of require of us. Um, and yeah, getting a lot better deals. I like seeing my supply costs. I had always struggled to keep my supply costs, down around that 5%, and I don't struggle with that anymore. And I really do attribute a lot of it to the pricing because I haven't changed what I'm ordering. I haven't changed the types of supplies that I'm ordering. They've just gotten to where they can work with some better deals. So I do appreciate that.
Oh yeah, for sure. As far as in the DSO environment, with other docs that are a part of the same group that you're a part of, have you seen a big? I mean, I know it's very tough pushing for productivity. I mean, it's because people take that the wrong way. You and I've talked about this before, but it's like if you take great care of your patients, productivity takes care of itself. And I know that insurance shouldn't determine where and how we determine what treatment plan to provide. And that's where clinical calibration, that you're one of the instructors in and helping us really beat the drums, that you have to have this clinical philosophy, and I think that makes it much more attractive to a DSO to go in with a dentist who already has a clinical philosophy. Did you tell us a little bit about your clinical philosophy and why it was so successful for you?
Right. Well, mine has always been very much a comprehensive care philosophy. I mean, you describe my practice as a practice, and we are. I do a whole lot of cosmetic dentistry, and I love doing that. But we do a whole lot of general dentistry, and we treat perio, and we do surgery. I mean, we really do it all. And that's one of the things that was always one of my visions for my practice is I wanted to be a place where patients could come and pretty much have 90% of their care taken care of underneath one roof. So I was always looking to build a group practice that we could treatment plan comprehensively, treat comprehensively, and we could take care of all of our patients' needs. So that's been my vision. Now, for me, how that's worked out is we as different doctors in the practice, and now I have 5 doctors in my practice by the time I count myself and Bob, and yep. Um, so we all kind of have our niche, kind of our area. I am a believer, even though you and Bob Leedy have proven me wrong on this, but not every dentist could be a jack of all trades. Not every dentist can be good at all of it. And I would say most maybe are not capable of being good at all of it. So the way I've kind of managed that within my practice is I always encourage my associates to let's pick a lane, let's pick a niche, let's pick something that you can get super passionate about. I'll send you to the best CE courses. We'll seek out the very best, but I want you to kind of nurture that lane. I never tell my associates they can't do other things, but I want you to nurture this lane. I'm going to nurture this lane. And I think that works out really well for our patients. And our patients, part of their new patient tour is that they may see one or all of us because we all do different things. And depending on what the patient's needs are, they may get to meet several of us, on their journey through their dental care. And I like that.
Oh, I agree. I mean, I think back when I first opened my practice, that was at a time where I was right out of the military 4 years. I had great surgical skills because I had done a lot of that, and some great pre-prosthetic stuff. I really was getting into implants in the mid '80s, early
Yeah.
'80s, and but I didn't feel like I knew perio, even though we had great perio program in school. So I hired a periodontist to come in, and then I had endo. I had an endodontist coming in. So at that time, I brought in, as a young dentist, I brought in 3, 4 different specialties
That's awesome.
to help me. And as I got more, yeah, an orthodontist I had in the office because I didn't know anything about ortho, and I really honestly don't want to know anything about ortho, but I had them there kind of with the same philosophy that you're talking about is like, I really want it to be a one-stop shop. And so as I got my clinical skills aligned for different things, and the periodontist, it was time for him to go because I had the periolays and I thought I want to do this now. And then the more education we get, I think it allows us to do that. And then the ultimate um, solution is where you've got a mature practice that's been growing like yours. And then as you bring associates in, you actually get to do the same thing because at that point in time, I really wanted to be in that one lane. I wanted to do reconstructive stuff. If you were a train wreck, that's what I wanted to do, but I didn't really want to do the endos that needed to be done and all that stuff. So I found that same philosophy to be extremely helpful. Has being in your DSO, do they have any specialists that travel office to office, or is it pretty much allowing you to do whatever you decide?
Yeah, so they don't within the DSO, but they have forged some relationships with some traveling specialists and such. My DSO is somewhat unique, and not really unique. The DSOs are every shape, size, and color, as you know, but we are spread out throughout the US. I mean, we are not regional. We're also not even specific as far as specialists. I mean, we've got an endo group in our practice. We've got GPs in our practice. We've got keto in our practice. In our DSO. So we're very diverse in that way. So again, it would be they do not have a clinical calibration for us as dentists. And that is one of the things. I mean, that's one I was talking with Victoria at Dykema just a couple of months ago, and she was telling me about clinical calibration and her wanting me to be involved. And I got so excited about it because as I'm experiencing my own DSO and as I've talked to lots of other people in the DSO world, traveling for support DDS over the last couple of years,
Right.
man, that's what they need. They need, because to me, it's like, rather than you mentioned, they push productivity, and I have to be honest, I was venting to Bob about it this weekend. These laptop quarterbacks, that want to look at the numbers, and they've never hardly stepped foot in a dental office, and somewhere they think this is gonna happen because they're seeing a trend on their laptop, and they think they're gonna blast out this message to everybody, and all of a sudden, productivity is gonna go a different direction, and that's just not the way it works. I mean, I was venting this weekend. We're not making widgets over here, it's not about we just need more people on the production line to make widgets. There's a whole, there's a lot of things that go into that. So, I do think what you guys are getting into clinical calibration, and man, if you could take that to the DSO world and get them to adopt it and implement it, that's where they're going to get their productivity, because you're going to teach doctors, just like you've taught me over the years being a PDA client, of just how to take really good care of your patients and how to talk to them and how to, I'm going back to my own practice being a cosmetic practice. You taught me to it's okay to talk cosmetics with every single patient that comes in the door. And it's not about you're trying to sell them something. It's about, we've got these risk factors, and then we're a cosmetic practice. And sometimes people want to talk to us about the looks of their smile, and you just go through, you're going to talk about all these other risk factors. Would you like to discuss the looks of your smile? And they happen to have you have that big smile picture up on the screen behind them. And guess what? Most of them say, yeah, I want to talk about my smile, So you are definitely one of those people that taught us how to have those conversations and how to make it flow, and thus productivity follows because,
It does.
just take good care of patients.
How do you, I mean, I'm going to ask two different questions. And one of them, I think I have a pretty good idea what the answer is, but I'm going to ask it anyway. But first question, the kids that are coming out, and I can say kids now because I'm old enough to do that. The kids that are coming out of school today really haven't gotten the same training I feel like I got a century ago. I mean, I had done perio surgery. I had done over 300 extractions. I mean, there was so much stuff I did in dental school. And now, after COVID and all this stuff, there are dentists that are actually graduating that have never extracted a tooth and they're
Absolutely.
graduating from dental school. So, have you seen anything along those lines in your, because you're out doing a lot of other things too, with support, DSO and, all of that. So have you seen in your
Yeah, I definitely have, and I mean, I have a young doctor in my practice right now who's a year out of dental school, and, I yes, there's a big difference between how we were trained. Mine was 25 years ago, even how associates were trained 10 years ago. And man, I hate to keep giving COVID credit and blame for everything, but you are exactly right. Post COVID, something significantly shifted. And I think we could probably talk about that if we were talking about elementary schools right now too. I think we could talk about it just about education and experiences in general. But honestly, I think what might have just happened is that the bar got lowered,
yeah.
just we had 2 years of things being shut down, and I could imagine in dental schools, patient availability not being the same or having to space patients out. I can only imagine what those bays look like during COVID. We used to would have 30 patients in one bay. They probably went down to they could only put 5 in a bay. I don't know. I wasn't there experiencing. I was trying to keep my own business alive. But
Right.
I can only imagine that that's part of what happened, and so the bar just really got lowered. Those kids graduated, they went out into they didn't kill anybody, so, hey,
Right.
let's just lower the bar
Let them go.
moving forward.
I wonder if tuition dropped.
Yeah, I bet it did.
I don't think I'm just wondering, but I look at that as kind of a responsibility. How do you calibrate your associates and your
Right.
team to the diagnostic standards that you want? And it can be within a DSO, or it can be in a private practice fee for service, or it can be in a private practice totally insurance driven. But what are some of the ways that you learn to calibrate your associates?
Yeah, I mean, one, it's been evolving, right? And it's
Yeah.
still evolving. And one of the things I'm grasping onto right now is this curriculum that you guys are putting out there, and how can I utilize that to continue calibrating my associates? Because there's been times I've been good at it, and there's times I've pretty much failed at it. And I think the things we do right now, we have a weekly doctor meeting. And part of that weekly doctor meeting is always going over cases. Sometimes it's cases they bring to me that they have some questions about or that we're going to talk about as a group. The question isn't always for me. Sometimes it's for one of the other associates, which is great. I love it. But then there's sometimes it's me pulling up an X-ray from something I saw yesterday. And a common topic of conversation is, when is a tooth savable and when it's not? And man, you line 10 dentists up, and man, that is the place where there could be a lot of disagreement. And so I just try to not tell them what they have to do, but, "Hey, let's look at this a different way," "And what would you want if it was your tooth?" I mean, "Could you do a little crown lengthening on this tooth and save this tooth?" And sometimes it's because they're scared to death of crown lengthening. Well, crown lengthening is not that difficult.
Yeah.
There's a lot of ways to go about doing it. I've got a great laser now that'll do it, hard tissue laser
Yeah.
that'll do it, but a burr works too sometimes if
Yeah.
and the question might be, did you even have that conversation with the patient, or did you determine that it wasn't savable and so you doomed this tooth to an extraction implant or what have you? Did you even talk about with the patient what the steps that it would be required to save the tooth? So, just things like that we try to calibrate on, and I enjoy those types of conversations.
Oh, absolutely. What I found, and you're probably getting to a point to where you're seeing it, being in practice a long time. But I used to early on in my career, I wanted to save everything because I figured if I can save it, I will save it.
Right.
And that was my philosophy. That changed drastically when I realized that the patient was never going to brush their teeth. They were drinking Dr. Pepper all day long, and their gums and their perio was going to be. In other words, I wanted to save the tooth because it was a tooth, and that's what I knew. And that's really where the risk factor started to come to play when I was making that decision. Okay, what are the chances of this tooth being in the mouth if I don't treat it at all 5 years from now? Or what, and so I was always, and I was really one of those guys who I would talk people in because I'm pretty good at talking people into stuff. I would talk them into doing a full mouth rehab
Right.
and spending 30 grand.
Right.
And then I would see them 4 years later and they're starting decay all over again. And I thought, well, at first I thought, well, my preps must have been bad, or my
Yeah.
margins weren't good enough, or whatever. And then I realized when I heard John Coyce years ago talking about it, I go, hey, when I'm making my plan, let's make it successful for both of us. Not that I can, yes, I know I could fix it too, but you got 7 more just like it right in a
Right.
row. Are you going to change the habits that got him here? So
Yeah.
that's what
Yeah.
really that's what really kind of changed in my thought process, and that makes it really hard when you're working with an associate to get them up to speed, but that becomes part of the conversations we have with younger docs. And
Right.
Braden, my
What?
nephew, I mean, Braden is like knocking it out of the park because he's heard this philosophy now for 7 years, and he's only 2 years out of dental school. But the more we just reiterate that there is no dentistry is there's a lot of gray in dentistry. It's
I
black
was
and
about
white.
to say that. I was about to say, I mean, isn't that, because people expect there not to be. I mean, people expect there to be no gray in dentistry, but it is not black and white. I mean, in fact, a common thing I say to my team, I'm like, dentistry is a thinking man's game. It's a thinking man's game. Like, you got to be thinking, because what was right yesterday may not be right today for factors you just said. This patient's risk factors, you know, um, there's all kinds of things that have to be weighed in, to making a decision. So it's not black and white, which I love that. I think I kinda live in I feel bad when I say that. Like, in fact, I have a team member that says her name's not Doctor Green, her name's Doctor Gray, and that kinda makes me feel bad. Like, does that mean I have no values? I don't think it does.
No, no. It really is something that I think, I think the all of our experiences that we go through, all of the courses we go take, all of the friends that we have that are in dentistry, and because Cynthia gets so bored because we talk teeth all the time, but she's now found her friends to come and talk about their stuff too. So,
Right,
but it's one of those things where the more you see, the more you know, and the more you know, the more you do. And then that's why treatment plans for a young doc might be $1,500, and treatment plans for a more experienced doc might be 8,000. It's
right,
not that the one doc is telling you need this. I like the what was it? Reader's Digest said, "Oh, one dentist said that all you needed was a cleaning, and that was it." But
right,
they didn't ask, "Do you like your smile?" They didn't ask, "Do your jaws hurt?" They don't
right.
because they don't have that skill. So, what advice would you give docs under pressure to produce by volume? Uh, the question would be, how does that fit into, well, it doesn't necessarily, but comprehensive care? How do you
Right,
know they're being kind of pushed into this volume environment, but
right.
that we know that there'll be such a more enjoyable experience for their career if they can just learn the comprehensive care approach. So, what are your thoughts on that? What advice would you give a doc that's stuck in that position?
Yeah, no, and thank goodness I've never been stuck in that position. I'm probably as close to being in that position now just because I do have DSO partners, that look at things like productivity. But thank goodness I've really never been in that position. Because I hear the horror stories, and that is what most people assume about, you go into a DSO world and you've got an office manager that's telling you, you got to do 18 crowns, this week or whatever. And it's not about how you're gonna treat the patient, it's you gotta do 18 crowns, and they don't even think about the fact that there's human beings on the other side of 18 crowns, and, and so then they think they've gotta go in and do 2 crowns on a 16-year-old. Well, Bruce, do you wanna do 2 crowns on a 16-year-old? No, I don't wanna do 2 crowns on a 16-year-old, you know? So but they feel like that's what they have to do, and they think that's what the productivity is about, and it's not. It's the same thing you've always said. It's about learning how to take more comprehensive care of your patients. Um, you know, we're about to introduce the product, and I know it's been around for a while, so people listen to this will be like, "Oh, wow, she's behind the times," but we're about to introduce the product Curidont, I've heard some good stuff about Curidont, and I'm all about that 16-year-old with an incipient class 2 lesion. I would much rather put something on that tooth that I think is going to reverse it than
Mhm.
to cut a class 2 box, right? I mean, You're shaking your head. You don't want to cut a class 2 box either. Bob and I have a philosophy that like we want our patients to leave better than they came in. And
Right.
I a 16-year-old that I'm cutting 4 class 2s, they're not leaving better than they came in. They're just not. Even if I do the best class 2s in the world, that tooth is compromised for the rest of their life. Um, so anyway, just doing some things like that, I think, and unfortunately, it is going to require my advice for that young dentist that it's going to require some fortitude, and it is going to require some checking of your own value system and standing up against the manager that just wants you to do 18 crowns, but
Yeah.
you also have to have they're running a business, so you also have to have your solution. So what is your solution? Is
Right.
it to get more education and bring in new products like a curodont or, um, laser periotherapy or something along those lines? I just think you have to expand your own knowledge so that you can still meet the production demands, but maybe not in the way that the laptop quarterback thinks you should do it.
Right. Right. Yeah. I mean, it's like, it's so funny. I get the pleasure of going into offices. And when I came into, went to 5 offices this spring, went from Oklahoma to Missouri to Kansas to West Texas to
Appling, yeah,
Northeast Texas, but it was really with all phenomenal dentists, really clinically just superior dentists. But one of the things that I noticed is everybody's got their way of doing things. And it's not bad to have another set of eyes come in, because I just walked around and said, "How do you do this?" "Oh, okay. Well, how do you do that?" I actually learned a lot about, man, if I was still prepping teeth, I would do it this way.
right.
But then there were other things I said, "Well, why don't you do this like this? Or why do you call this a two surface composite, or why are you doing this type of stuff?" And what I found was every practice has the opportunity, even if they're doing comprehensive dentistry, and you were doing comprehensive dentistry when you came to PDA, and all of a
Yeah,
sudden you go way up here.
absolutely.
And I see the dentists that are, and it doesn't matter if the DSO or whatever, because we get the chance to visit with so many different dentists. But if we can take a young dentist, back in my day, we used to have study clubs. So we would all sit in a
Mhm,
study club, and then we would ask questions and drink beer until
mhm,
we got a lot of answers. And that's how we
mhm,
caught up with the older doctors. And what are you doing? Why do you do that? Well, why is that? Well, I went to this
right,
course and this is the research behind it. Whereas today, well, today is very different. Today, the answers are right there for you. You just have to be interested in finding them out.
yeah, absolutely.
And it's very tough when you have a production. I remember one time listening to a DSO telling everybody on the call, hundreds of dentists, that we're doing 1.6 crowns, per day. And do you realize that if we were doing 2.2 crowns per day, that would be another 30 million to the bottom line? And I'm going, yeah, but that's not the way you do 2.2. What are they gonna do? Just all of a sudden, just out of their brain, just say, "Okay, let's do 1 extra half crown a day." They
If you wanna be the recipient of a half crown, I don't want a half crown in my mouth.
I'm not I just I just shook my head, but, bottom line is we're just trying to to balance in the DSO world, balance our autonomy with
Right,
comprehensive care and taking great care of people, and I really think you can do that in any environment. It's really up to the doctor and kind of what you've learned, but, I love that.
yeah,
And CCI, the reason that Clinical Calibration Institute came about was because of us seeing this big difference between somebody who is being very productive and someone who's not. And even in our own office here, young doctor, now, I mean, he was doing probably, I mean, I've seen see doctors are doing less than the hygienists. They're doing 200 an hour, 150 an hour. How do you make a living? How do you enjoy work when you're not making a living?
right,
And so we even had one of our docs here that was really struggling to be productive.
right,
What we found was I told him, let's do education. Let's go here, go to this course, go to this course, go to this course. but I knew in his heart he wanted to be a comprehensive dentist. He just didn't have the experience. Today, he's doing over 1,000 an hour. He is just, and the 1,000 an hour is not an indication that he's working fast. 1,000 an hour means, I believe, he's taking better care of the patients. And I
Totally.
hear more, boy, I just love Dr. So and so, because he's learned, and we all have to. And I think this
Absolutely.
is going to take not only the doctors, not only the associates, but it's also going to help front office learn because a lot of people, your front office came from the bank. They don't
Yeah.
know about any of that, or they came from a collection agency, or they came from wherever. But you have to have a clinical philosophy that is comprehensive. And I just loved visiting with you. You make me feel better every time we talk. So,
Well,
well,
likewise, likewise.
for those of you who, would like more information, send me send me an email to bruce@productivedentist.com. Um, Nikki, thanks so much for your time. I know you are a busy, busy, busy doctor. She travels all over the world actually. And just to have you on my podcast is everything to me. So
Well, thank you, Bruce. I always enjoy chatting with you. I definitely get smarter every time, whether even if it's a dinner over cocktails, I'm smarter by the end of our conversation.
I get a lot smarter after a couple cocktails, actually.
Yeah, me
didn't know
too.
he do that. I know Bob does too. So anyway,
For sure.
I know, but thank you guys for listening to Productive Dentist Podcast. And please tell your friends about it and tell your friends about CCI, Clinical Calibration Institute. Just go to productivedentist.com and you'll see all the information about it. I mean, it's going to cost your office less than $500 a month to train your entire team and to get so much education. So
Yeah.
I look forward to seeing you guys, meeting you in the future. Thanks, Nikki. Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.